Um,
Hello and welcome to Podiatry Practice Mastery. Don Pelto here, and I have Dr. Ben Pearl here. Welcome, Ben.
hey, nice to
How
see
are
you again,
you?
Don. Good, good.
Yeah. And today we are going to chat a little bit about electromagnetic therapy. It kind of seems like voodoo to me. Everyone's have these new therapies, and I kind of say, tell me a little bit how you got interested in this and kind of what it's been doing for your practice.
First, let me jump off the voodoo therapy because I think that is very accurate to what people's
Impressions are.
Yeah, magnetism. You know, when they came out with those magnetic insoles, I think in the late 80s, early 90s, the Gauss, which is the energy unit, is maybe like half a Gauss, if that, in one of those insoles. So you have to have some energy to affect a change. So like we jump up to an MRI unit, which has several thousand Gauss, and there's a huge jump between, you know, what is basically an ineffective insole because there's just not enough charge there to do much, versus an office-based unit where you're actually hearing a ping, just like you would in an MRI unit, of the cycle of the magnetic amplitude up and down, and you hear that. It's very interesting. And
so I'm gonna, as we're talking about
static feeling.
I'm going to share my screen. So this is an example of the machine that we're talking about here. And once again, we're not going to we're not selling this to anyone. We're just kind of talking about it because I think I like to bring in new technology. This is kind of the machine. You kind of put your foot in here and kind of how it works. And if you want, I'll put a link underneath this show if you guys want to look more about this machine. And this is kind of some of the advantages and things like that, and some videos in Ben's practice. But so tell us a little bit more about it, Ben, kind of how you got interested in it, how it's affected your practice, how long you've been using it, things like that.
Well, there's been some major manufacturers that have been using these for a while, and some of my colleagues have been using some of the units. And I looked around at some different technologies, and I found one that fit my practice profile. And, you know, there's a lot of different things, price point, efficacy, things that you need to kind of feel out. And I started using the unit, and let's just start with the basic principle. The basic principle is that with all these regenerative energies, you're priming the breakdown of ATP to ADP. And in the case of electromagnetism, it's a hydrolysis situation. And once that ATP goes to ADP, a packet of energy is released. And the cells that are deficient use that energy to heal. Now, in addition, with things that are charge related like nerve and bone, which has a piezogenic effect. So even when we're walking, we're affecting a charge, very low, mind you. But that has been talked about with one of the essential elements, with the ions that are necessary for bone healing when we have fracture healing. Just mechanical pressure can create a small electric charge field. And we have these ions in our body. Our bodies are basically analogous to batteries that respond to charge. And so not only do we get that packet of energy release, but we get buildup of priming the circuit of nerve conduction, which also can be primed by electric energy, electromagnetic energy. And electromagnetic energy is different than like traditional galvanic stim, in that the magnetism goes at a deeper level. That level penetrates at something related to Newton's inverse square law. So the depth of penetration is much greater than like a superficial TENS unit. That's where you get the deep charge that helps with bone healing, that helps with sprains, that helps with wound healing, that helps with neuropathy. These are all things that I've been using it for.
Good. So let's bring it really down, really far down. Let's say I'm a patient, and if you just said that to me, I wouldn't understand. And I still don't understand anything you said. So I come in with an ankle sprain. I come in with plantar fasciitis. You know, how do you use this on those things, and how do you explain it to the patient in conjunction with all the other stuff that we could offer, like cortisone, shockwave, all these other types of things?
I absolutely do. And the reason I do is that it is a touchless therapy. So even when considering, and I still love shockwave for plantar fasciitis and Achilles tendinosis. However, I like this in that if somebody is super sensitive and I'm worried about beating them up with, like, let's say a radial shock wave, which many of us have in our offices.
Yep. It beats
And
them
I
up.
think it's a great tool. I don't want to knock that at all. I think it's still a workhorse of a tool. The electromagnetism offers me not as much pain for the patient while they're rendering the treatment. So it's in effect, it almost feels like static, like you're taking your laundry out of the dryer, and it just has that little kind of prickly feeling. That's it. Now, occasionally you'll get a little bit of a highlighting. Let's say I used it on my iliopsoas, that front flexor muscle that really gets tight when we're sitting down. So I just use it, and it really caused this oscillation. I thought it was like, what am I hitting my femoral artery or something? Because it was really pumping, and I really felt the deep penetration of the magnetic field. Right after the treatment, several hours later, it felt a little irritated, but then the next day it loosened up. Now with things, it's interesting because that was like just a very sensitive area. With things like plantar fasciitis, however, I find that there's almost an immediate, wow, that is like interrupting that throbbing pain signal. So there's also a pain gate theory, which you know about, where we inhibit the signals of pain by offering another signal. Not only that, but it has different frequency waves. So it's not just one continuous cycle. It's going 15 hertz, it's going 7 hertz. So in effect, it's sort of, quote, tricking the body so that the body isn't habituating to one pattern. It's throwing different stimuli at it. So that is at least a partial explanation, that the inhibition of pain signals, at least in terms of pain. And then our blood has iron, which is also reactive to charge. So you get this upregulation of circulation. And I was talking to you about a patient of mine that I suspect with gout, and I don't know how well, and I think we talked about it. I have all these videos up on my FitFootU site, so it would be easier to see the videos there than me to try to show you the phone picture. But you literally see where the toe that was swollen, in this case, gout typically affects the big toe. He also had some ankle pain. Right at the base of the toe, it was less pink. It was almost like mottled, like kind of skin tone and pink, like mixed in, because the swelling had actually lessened right directly after the treatment. When he got up out of the exam chair, and this is typical, without any cortisone or anything, he said he was about 25% better. And to me, that's like a home run. Oftentimes I will find that later that day, they'll feel even better. And then the trick is, how long does it sustain and how many treatments do we need? Typically, I'm only doing a few treatments. I'm not like with some of the laser options, let's say for neuropathy, you're doing 10, 12 treatments sometimes. I am getting nice neuropathy results, 3 to 4 treatments. I'm not saying, Don, that I'm getting full recovery of sensation. That's not what I'm talking about. I'm talking about more movement in the toes. When my diabetic patients have a lot of stiffness from the neuropathy, that nociceptive gnawing or burning pain is diminished significantly. So those are the things. And there's been, by the way, some NIH papers. I was looking at one this morning. So if you Google the search terms, you will find some stuff that's reviewed by the NIH. That particular study I'm referring to was about 800 Gauss. My unit, I go up to about 3,000 to 3,500 Gauss. So you're getting quite a big bolus of energy.
And this technology, you told me the name again. What's the generic name for it? Okay,
there's several generic names. The one that most people are familiar with, and if you Google it, you're going to find all kinds of devices sold on Amazon that are lower Gauss units. Those are home-based or wearables or mats. And the term is PEMF, pulsed electromagnetic frequency. Okay. And so it's in a pulsed fashion, and electromagnet obviously refers to the energy source. Now, the units that are available for a medical office are going to be a much higher level of Gauss. And in some, and there are different trade names, and I'm not going to put, which one is with which, but there's EMTT, there's PMST, and I'm not even going to mention any, I don't want to get into advertising, but these are different higher levels of PEMF than the ones that you would get, let's say, ordering off Amazon, for a smaller unit.
Interesting. So I know there's always a lot of different types of treatments for example, plantar fasciitis and other types of things. What's your experience in terms of fitting it into your workflow? Like, for example, for shockwave, I might do 3 shockwaves and then do a 6-week break and then another 3 if I need to, or do 4. Do you do it like in conjunction with shockwave? Are you doing it in conjunction with cortisone? Are you just doing it standalone? How long do the treatments take? Do they sit there and you put their foot in there, you can leave and see another patient? How does it go with the ones that you've been
That's a great question. First of all, both with shockwave and with electromagnetic treatments, I do not mix and match cortisone because I feel that's doing the opposite. It's throwing the T cells away, and we want to bring those cells to the area. These things upregulate the growth hormones and upregulate the helper cells, the T helper cells coming to the area to induce tissue repair. I was reading a study this morning about wound healing, and they were looking at zinc and how electromagnetism is used in conjunction with zinc as an ion to help promote healing. So they were using both. And that's the other thing that I'm going to be looking at. I was talking to you about this, like things like warts where I do candida injections and I'm just hitting that spot wart. Would this help perfuse it more? I think so. So I think that there would be an opportunity to maybe even get a bigger blanket effect from the candida potentially. And I've even used this, Don, with situations where I have a very swollen ingrown toenail, and it's one of my blue collar workers. They got to get back to the workforce. This is their day off. So I say, Mr. Jones, this injection might be difficult for me to do, but here's something I can do for you. I can do, and of course, this is a cash proposition. There is no insurance code for this particular type therapy. Delayed unions, non-unions, yes, you can order the units that would be insurance covered. Not my unit, though. That doesn't fall under the same code. So I offer that to them as an option. We can lessen the swelling. And in fact, I will even, after I do the injection, to perfuse the injection, put them back in the ring to try to perfuse the anesthetic so that I obtain a better block. And I'm not charging the same amount because this is kind of an auxiliary procedure to the main procedure, which is, the ingrown toe. Sometimes what I'll do too is I'll say, look, we can get you some immediate relief, Mrs. Jones. I'd rather you do the antibiotic. Your toe is swollen. It's going to be hard to drive this in. I know that, pain is difficult for you. Let's do a treatment today just to take the ebb and flow down a little bit on the swelling, and then come back and see me in 5-6 days after you've been on, let's say, the oral Keflex, and then let's do the procedure. So I've done it both ways.
I find in our practices, if you're interested in learning new treatments, I tend to find that it can be overwhelming in trying to explain so many treatments. You really need to kind of hone in on or do a package. Say okay, we have this plantar fasciitis package. You're going to get shockwave with this added on, and just call it whatever it is, your regenerative package, versus, because if you explain shockwave, then I'm going to do this electromagnetic, and then you're going to do all these other things. I think it gets confusing for patients with too many options. It gets too complex. Which one do you choose? Do you do packages, or do you just say, hey, I'm going to try this, and then we'll try the next thing. We'll try the next thing.
Exactly to your point. What I've been now introducing, Don, is instead of going, and we all have our preconceived notions, like, oh, wow, gosh, I've been doing radial shockwave for plantar fasciitis, and it's been working out pretty well. What I like about this is I can lower the price point slightly. Why? Because it's not like I'm not going in to check on them. I do, but I can set that ring up semi-unattended. Let's just call it like that. Then I can come back and say, you know what, I want to take up the amplitude a little bit. I'm going to increase the Gauss, go up to 80%, let's say, as opposed to 60%. take it up a little bit, but I'm basically working with another patient in another room. You asked about workflow.
Yep.
So it's basically adding a technical assistant that isn't a person to your, and that has been the revolutionary thing. You know, the shock waves, I am doing them myself, as most people do. I don't know too many states where you can have a tech do that sort of thing. But at any rate, apart from that discussion, it frees up my time. And so I am now using this as my primary go-to. It's become sort of my Swiss Army knife in my practice. And I'm not saying that things like laser and shockwave aren't still useful. I just prefer, with the management as an intro treatment, I know it's not going to hurt them generally. That this has just been a great tool. And then if I'm not, let's say, getting any delta, any change, then I say, you know, we'll do maybe a couple of these, and then maybe let's try a radial shockwave. So I don't have a particular formulaic, because I find that my patients respond differently, even with the same clinical entity, to different things. Some people are just seem to be more biologically receptive to electromagnetism than others, but it's been, I would say, and this sounds crazy, but like 80 to 90% of my patients are responding in some positive way, even if it's minimal to this. I haven't had too many that like, oh my gosh, it hurts so much. And I had that happen occasionally with laser or even shockwave, where they said, you know what, it really hurts after, and then you have to explain that's part of the healing process. We're trying to recruit things to the area, et cetera, break up scar tissue.
Well, cool, Ben. I'll put a little link underneath here of your website where they can learn more about it, and let people search it out. That's what I like about talking about is new technology. I know in early January you're having something on biomechanics. That's another area. So tell us a little bit about that as we finish up, and then any last words.
Yeah, so it's going to be really great. I'm going to have one of my new heroes, and I'm going to pump his book, Richard Blake. He's done now the second edition, which I've previewed. And Don, I call this book, and he'll be one of the featured speakers on two things. One on limb length discrepancy, and then he's going to do just sort of a general his biomechanical approach. But it's kind of like a gold key book. I mean, it's got so many pictures. It's cross-referenced. You know, he'll talk about something on tarsal tunnel, and then jump over to Morton's neuroma and talk about, you know, ways that you can do neural release and neural flossing, as it's called. You know, I didn't even know much about neural flossing, but then he describes and has pictures of the extension flexion of the toes. And so, you know, you look at the pictures, and it's just really good for the lay person as well as the seasoned practitioner. So he'll be there. I'm going to have this Simon Bartold, is always entertaining, from Australia. He'll be talking about innovations in shoes. I've got, you know, from kind of more the barefoot science world, Golden Harper. He's one of the developers of the Alter shoes. We've got Natch Chocklingham from England. So it's an international thing. He's going to be talking about things related to shearing and some other biomechanic metrics. He's a PhD in biomechanics. So it's going to be really good. It's January 19th, and you can email me at arlingtonfoot@gmail.com, and I know you'll provide the link. And it's a nominal charge for everything that's been involved in putting it together. And it's virtual, so you can sit there in the comfort of your home and be in your PJs and have your hot cocoa or whatever, and just enjoy and listen in.
Great. Okay, Ben. Well, thank you for all that work putting that together. I know whenever you try to do an event, it's like herding cats, and so it's not an easy thing.
It really is, and I appreciate you, you know, passing the word. And I hope, you know, in fact, I'll give you a comp on that, just because you know, we've been working together. If you want to attend, and I think it'll be good, even. And I'll have it post-production. It'll be available. There'll be a small
if you're watching this after, you guys can check it out. And until next time, okay, Ben.
Yeah, man, I wanted to leave on a comical note. It's been a serious year, so I thought I'd invoke a little Sly Stallone on what he'd maybe say about magnets. And he'd say, you know, I don't know about magnets. You know, I think I met a guy from South Philly. I think he had a magnet in his head, but, you know, I'm going to try to stay grounded this year. Peace out.
Thanks, Ben.
On the fly. All right. Good to
That's a
see
good
you,
one.
Don.
Good to
Happy
see
New
one.
Year. Happy New Year, everybody.
Great, thank you.